Another quick moment with Dr. Lamore. We're talking about low back pain. Low back pain can be mechanical, but there's another aspect I want to talk about. I want to talk about the effects on the nerve, right? Chiropractors work with the adjustment on nerve function. So I teach patients the low back, the nerves of the low back do bowel, bladder, reproduction, and legs. So you can have symptoms not just from the low back and muscular, but you can also have it in the bladder, bowel, and reproductive areas. So when you have a pinched nerve and it irritates the muscles, it can also change function. We also look to the foundation of chiropractic progress that talked about adjusting kids for colic or bedwetting. So understanding most kids don't have mechanical low back pain. They're going to present with the bedwetting. It's an example where the nerve has been irritated and alters function. So we see it in bowel and bladder dysfunction. So one of my friends and colleagues, Dr. Morgan, who's a president of Parker Chiropractic College and a former chiropractor at the Naval Hospital, wrote a great article on the neurogenic bladder. Understanding you can have a pinched nerve and not only have mechanical aspects, but changes in function. So somebody with long-term chronic low back pain, I'm going to educate them on the effects that it has on the nerves of the bowel, of the bladder, and of the legs. So one of the things I teach my patients with chronic low back pain is go to CVS, get some urinary test strips, have them in the medicine cabinet. So this way, if there's any question whether you're having an infection or an issue, you can test yourselves. One of the things we see as we age with the neurogenic bladder is what the body's response to an infection or massive infection called sepsis. So having this in a medicine cabinet allows you a tool to test yourself. Again, sepsis is an important thing. We see it in the respiratory system, digestive system, blood system, and the urogenital system. So that's a real concern with somebody with low back pain. Understanding that you can test yourself at home. Chiropractic doesn't treat infections. This way, if you have an infection, you're going to go to the ER and see your medical doctor. But you want to be proactive and make sure that you avoid infections, or you test for an asymptomatic urinary tract infection from a neurogenic bladder. Another quick moment with Dr. Lamore.